21 days before diabetes destroys your organs, this warning appears. Every year, millions of people learn they have diabetes only after damage has already started in their eyes, kidneys, nerves, or heart. That is not because the body stays silent. It's because early warnings are easy to miss, easy to blame on stress, age, or a busy life. The truth is that high blood sugar can start harming tiny blood vessels and delicate nerves weeks to months before an official diagnosis. In many people, the first cluster of clues shows up in the preceding 21 days, especially during periods of higher than usual glucose. Today, you'll learn how to recognize those clues, connect the dots, and act before small problems become permanent damage. Your body is an extraordinary messenger, and it rarely whispers without a reason. Fatigue, thirst, blurry vision, or strange skin changes are not random. They are your built-in dashboard lights. When you know what to look for, you can catch rising glucose early and protect your organs from long-term harm. This video is designed to make those signals obvious and actionable, so you can move from worry to a plan. If you're new here, welcome to your health journey. We're honored to be part of it. Hit like, subscribe, and tell us in the comments where you're watching from so we can cheer you on. Before we dive in, a crucial reminder. This content is educational and not a substitute for medical care. If you recognize several of these signs in yourself or someone you love, book an appointment with a healthcare professional and ask about testing now, not someday. Diabetes and prediabetes are diagnosable with simple blood tests, and early action can literally prevent organ damage. Keep a pen handy as we go and jot down anything that sounds familiar in the last 2 to 3 weeks. Those patterns matter more than any single symptom. Let's walk through the 16 warning signs that often appear in the 21 days before diabetes begins to harm your organs. These signals are common, but their pattern, persistence, and clustering are what make them meaningful. After the list, I'll give you a 7-step action plan you can start today, including which lab tests to request and how to track your blood sugar at home. We'll also cover red flag emergencies that require immediate care. Most important of all, you'll finish with a clear roadmap you can use right away. Sign 1: unquenchable thirst that doesn't match your activity or the weather. If you've been unusually thirsty, reaching for water all day, waking at night to drink, craving ice or very cold fluids, your body may be signaling excess glucose in the bloodstream. High sugar pulls water out of your cells and into the urine, and your brain responds by driving thirst to prevent dehydration. People often blame this on salty food or dry air, yet the thirst keeps returning despite drinking more. Notice if you're carrying a bottle everywhere, or if your mouth feels cotton dry between sips. Persistent thirst over the last 2 to 3 weeks is one of the earliest, easiest clues to spot. Sign 2: frequent urination, especially at night. Nocturia. When glucose rises, your kidneys act like safety valves, pushing the excess sugar out through urine, and water follows that sugar. If you're up 2, 3, or more times to pee at night, despite limiting fluids after dinner, your kidneys might be working overtime. Watch for larger volumes, pale color, and a sense that you just went, but need to go again. Many chalk this up to age or a small bladder, yet the pattern is new. Pairing thirst plus nocturia in the same 21-day window is a classic high-glucose signature. Sign 3: blurry vision that seems to fluctuate day to day. Elevated glucose pulls fluid into and out of the lens of your eye, changing its shape and temporarily altering focus. You might feel like you need new glasses, then the blur improves the next afternoon, then returns the following morning. This on-off blur is different from gradual age-related changes. It may be most noticeable when reading your phone, driving at night, or working at a computer under bright lights. If you've had random, foggy days in the last few weeks, your eyes may be telling you what your blood hasn't yet. Sign 4. Sudden, unexplained fatigue that sleep doesn't fix. Glucose is supposed to be fuel, but without effective insulin signaling, your cells can't use it well, and energy stalls. People describe a heavy, sandbag tiredness that arrives out of proportion to effort, especially after carb-heavy meals. Afternoon crashes become routine, and workouts feel unusually hard. You might nap more, drink extra coffee, or skip activities you normally enjoy. When fatigue clusters with thirst and frequent urination, suspect rising blood sugar rather than just being busy. Sign 5. Increased hunger, even after you just ate. Polyphagia. When cells don't get energy efficiently, your brain interprets it as a shortage and drives appetite. You may finish a meal and look for snacks minutes later, crave sweets late at night, or feel oddly shaky and ravenous mid-morning. Some people notice irritability or hangover if they delay meals, a sign of unstable glucose swings. If your grocery bill or snack drawer habits changed in the last couple of weeks, pay attention. Persistent, hard-to-satisfy hunger is a metabolic breadcrumb you shouldn't ignore. Sign 6. Unintentional weight changes, down or up. Early diabetes can cause weight loss because the body starts breaking down fat and muscle for energy it can't get from glucose. Pants fit looser, belts move a notch, and friends comment that you look leaner, even if you're eating more. On the flip side, insulin resistance can drive belly weight gain despite the same diet, especially if stress and poor sleep join the party. Any meaningful, unplanned weight shift over the last month deserves a second look, particularly when paired with other signs. Sign 7. Tingling, numbness, or burning in the feet or hands. High sugar irritates fragile peripheral nerves, often starting in the toes and fingers with pins and needles, buzzing, or fire ant stings. Symptoms may flare at night, in tight shoes, or after sitting with legs crossed. Some notice decreased sensation. Socks feel bunched when they aren't, or a hot bath seems less hot on the feet. Nerve irritation can begin surprisingly early and accelerate quickly if glucose stays high. Catching this in the first 21 days can help you reverse course before damage becomes stubborn. Sign 8. Slow healing cuts, frequent skin infections, or stubborn fungal rashes. Glucose-laden blood impairs white blood cell function, collagen remodeling, and tiny blood flow to the skin. Small nicks from shaving linger, scratches scab slowly, and insect bites swell more than usual. Watch for recurrent athlete's foot, jock itch, or itchy rashes under the breasts or in the groin. Women may notice recurrent vaginal yeast infections despite treatment. If little things on your skin aren't behaving like they used to, your immune system may be battling sugar, not just germs. Sign 9. Dry mouth, cracked lips, and itchy, dehydrated skin. Excess urination dehydrates you from the inside out, and your skin often shows it first. Lip balm runs out faster, hands feel papery, and lower legs itch, even with lotion. Some develop painful fissures at the corners of the mouth or along the heels. Notice whether water temporarily helps, only for dryness to rebound within hours. Pair dryness with thirst and nighttime urination, and you're seeing a connected story. Sign 10. Dark, velvety skin patches on the neck, underarms, or groin. Acanthosis nigricans. This common sign of insulin resistance appears as hyperpigmented, slightly thickened skin that looks dirty but doesn't wash off. It may itch mildly, feel velvety, or be noticed by a hairdresser or partner first. While harmless by itself, it's a loud siren that your insulin is working overtime. If these patches seem to deepen or spread over the past few weeks, don't ignore the mirror. Your skin is telling the truth. Sign 11. Morning headaches, brain fog, and mood swings after high-carb meals. Glucose swings can leave you foggy on waking and irritable by mid-morning. After a pastry or sweet coffee, you may feel briefly energized, then crash, headachy and unfocused within an hour or two. Some people describe cotton brain, where words won't come and tasks feel disorganized. Others notice heightened anxiety or a lower fuse. If your best hours used to be the morning, and now they aren't, ask what your glucose is doing while you sleep and snack. Sign 12. Frequent urination plus back or lower abdominal discomfort. Elevated glucose is a buffet for microbes, increasing the risk of urinary tract infections, especially in women. You may feel an urgent need to pee with little output, burning, or low pelvic pressure. In men and women, high sugar can also irritate the bladder without a true infection, creating urgency and frequency. If this pattern is new in the last 21 days, check a urine dip and a glucose reading rather than assuming just a UTI. Treat the sugar and the symptoms often settle. Sign 13. Leg cramps at night and restless, twitchy calves. Fluid shifts and electrolyte imbalances can trigger painful seizing of the calf muscles as glucose fluctuates. Cramps may yank you from sleep, or your legs feel antsy when you try to relax. Stretching helps briefly, then the tightness returns. Over time, nerve irritation and poor microcirculation add fuel to the fire. New nighttime leg drama combined with thirst and fatigue is a metabolic clue, not just a stretching problem. Sign 14. Changes in vision beyond blur, floaters, glare, or trouble with night driving. Early retinal stress can make headlights starburst, screens feel harsh, or dim rooms harder to navigate. You might enlarge fonts, crank brightness, or avoid evening errands. While many eye issues are benign, a cluster of new visual annoyances in a short window should push you to get both glucose testing and a dilated eye exam. Protecting your retina is time-sensitive, and early stabilization of glucose matters. Sign 15. Low libido, erectile difficulties in men, or vaginal dryness and discomfort in women. Blood vessel and nerve health are fundamental to sexual function, and both are vulnerable to high sugar. Men may notice weaker morning erections or performance that varies unpredictably. Women may feel dryness, irritation, or pain that wasn't there a month ago. These changes are often blamed on stress or age, yet metabolic strain is a frequent, fixable root. When intimacy shifts quickly, let that be a compassionate cue to check your numbers, not a source of shame. Sign 16. Nausea, abdominal fullness, or early satiety after small meals. High glucose can temporarily slow stomach emptying, gastroparesis-like symptoms, leaving you bloated, queasy, and strangely full. Belching, mild reflux, and upper abdominal tightness may follow carb-heavy foods. Some people feel better after walking or choosing protein-forward meals. If your gut has felt off for the last few weeks and routine antacids don't help, consider your sugar story, not just your stomach. Now let's connect the dots you've been noticing. One symptom in isolation is easy to explain away, but 3 or more clustering in the same 21-day period is your cue to act. A classic combo is thirst plus nighttime urination plus fatigue. Another is blurry vision plus hunger swings plus brain fog. Skin and nerve clues, acanthosis, slow healing, tingling, often walk in together. If you recognized yourself in 2 or more of these patterns, your next steps are clear and practical. Here is your 7-step, 21-day action plan to protect your organs while you get answers. Step 1. Get objective data this week. Ask your clinician for a fasting plasma glucose, HbA1c, and a basic metabolic panel. If available, add a 2-hour oral glucose tolerance test for nuance. If you can, pick up a home glucose meter or continuous glucose monitor and log fasting, pre-meal, and 1-2-hour post-meal numbers for 7 days. Data turns worry into a map. Step 2. Hydrate like it matters, because it does. Aim for steady, sip-based water intake through the day to support kidney filtration and reduce dehydration from frequent urination. Add a pinch of electrolytes if you've been peeing a lot or cramping at night, unless your doctor has restricted them. Limit sweetened beverages and fruit juices, which can spike glucose rapidly. Notice how your thirst and dry mouth respond over 3 days of consistent hydration. Small wins reinforce bigger changes. Step 3. Stabilize meals for 21 days. Build plates around protein, fiber, and healthy fats, then add modest carbohydrates last. Think eggs and vegetables with olive oil, Greek yogurt with nuts and berries, lentil soup with a protein side, grilled fish with leafy greens and quinoa. If you're hungry between meals, prioritize protein-forward snacks like edamame, cheese, or a handful of nuts. Consistency flattens glucose peaks and gives your pancreas a break. Step 4. Walk after meals. 10 to 15 minutes is powerful medicine. Post-meal movement helps muscles pull sugar out of the bloodstream without needing as much insulin. If you can't walk, try gentle chair exercises or light resistance bands. Stack this habit after lunch and dinner for 2 weeks, and watch your post-meal readings fall. Your mitochondria will thank you. Step 5. Sleep like it's your job. Even a few nights of short sleep can raise insulin resistance and drive cravings the next day. Aim for a consistent schedule, a cool, dark room, and no screens for 60 minutes before bed. If thirst or urination wakes you, front-load fluids earlier and speak with your clinician about short-term strategies while you stabilize glucose. Morning energy is your scoreboard. Protect it. Step 6. Foot and eye protection. Start now, not after diagnosis. Do a quick daily foot check for blisters, cracks, or color changes. Moisturize heels and wear well-fitting shoes. Book a dilated eye exam if blur or glare crept in this month. Micro damage is most preventable in its earliest phase, and small proactive moves pay off for decades. Step 7. Partner with your clinician and set a follow-up date. Bring your symptom list, a 7-day glucose log, and your questions. Do I have prediabetes or diabetes? What A1C and fasting numbers are we targeting? Can we screen for kidney stress with urine, albumin to creatinine ratio? Clear targets and a 2 to 4 week follow-up keep momentum high. You are not alone in this. There are also red flag emergencies you must know. If you experience nausea or vomiting with abdominal pain, deep rapid breathing, fruity or acetone-like breath, confusion or extreme drowsiness, especially along with very high glucose readings, seek emergency care immediately. These can be signs of diabetic ketoacidosis. In older adults with type 2 diabetes, severe dehydration, confusion, and very high sugars may signal hyperosmolar hyperglycemic state. Both are medical emergencies where minutes matter. You might be wondering, can 21 days really make a difference? The answer is a resounding yes. Tiny blood vessels in your eyes and kidneys, nerves in your feet and hands, and the lining of your heart's arteries are all exquisitely responsive to glucose stabilization. People routinely see thirst ease, sleep improve, and energy rise within 2 to 3 weeks of focused changes. Lab numbers often follow, and damage that might have become permanent gets paused or never starts. Let's recap the warning map your body has been drawing. Thirst that won't quit, frequent nighttime peeing, blur that comes and goes, heavy fatigue, hard to satisfy hunger, unplanned weight changes, tingling or burning in the feet, slow healing skin, stubborn fungal rashes, dry mouth and itchy skin, dark velvety neck or underarm patches, morning headaches and brain fog, urinary urgency, night cramps, glare and floaters, intimacy changes, and post-meal nausea are not random. In the same 21-day window, they spell one thing: check your glucose and protect your organs. If this video clarified what your body's been trying to say, take one step before the day ends. Book your labs, set out your walking shoes, fill a water bottle, and choose a protein-forward breakfast for tomorrow. Tiny actions compound quickly, and each one buys time and health for your eyes, kidneys, nerves, and heart. Share this with someone who's been so tired lately, or peeing all night. You may change the trajectory of their life. Thank you for being here and for taking your health seriously. If this helped, type "helpful" in the comments so others know it's worth watching. Like, subscribe, and ring the bell so you never miss our latest health breakdowns and step-by-step plans. Your journey matters, and we're honored to walk it with you. Stay vigilant, stay kind to your future self, and remember, when your body whispers, that's your moment to listen and win.